Tonight at 10, every part of the United Kingdom now in lockdown, with more than 1 million people infected with coronavirus. The message once again is to stay at home, to slow down the alarming spread of the virus across the UK. With a record 60,000 new cases in the latest 24-hour period, the NHS says it needs the public to follow the rules.
If people don't take the stay-at-home seriously, the risk at this point in time, in the middle of winter with this new variant, is extraordinarily high.
We'll have more on the surging nature of the pandemic and the latest on the vaccination programme. More than 1.3 million people in the UK have been given the first dose of a COVID vaccine, including a quarter of the over 80s in England. This year's GCSEs and A-levels in schools in England are to be cancelled as students take in that news.
Mixed emotions. I'm happy that our GCSEs are cancelled because me for one, I'm really stressed about exams because we've missed so much.
And 9 months after the matter was first raised, ministers now say they will bring in some kind of COVID test for travellers entering the UK.
And coming up in sport on BBC News, tributes are pouring in for the former Manchester City and England midfielder Colin Bell, who has died at the age of 74 following a short illness.
Good evening. Every part of the United Kingdom is now in lockdown, with people being urged to stay at home as the scale of the public health emergency becomes even more daunting. Such is the depth of the COVID crisis that the lockdown measures are widely expected to remain in force probably until March. Now, today's figures tell their own story. The number of new cases reported in the UK in the last 24-hour period is more than 60,000. That is for the first time since the pandemic started. In England, more than 1 million people are currently infected, and that figure is based on 1 in 50 people living in private households. But there is some progress, as more than 1.3 million people in the UK have been given the first dose of a COVID vaccine, including a quarter of all people over the age of 80 in England. Now, record numbers of people are in hospital with COVID, putting huge strain on the NHS and its resources. And the government's advisers say that some restrictions may still be needed next winter to try to keep the virus under control. Well, we'll start tonight with this report by our Deputy Political Editor, Vicky Young.
That sinking feeling. Here we go again. Across the UK, a return to deserted streets, empty classrooms and closed shops. All hopes now pinned on a speedy vaccine rollout. Until then, what will life be like? Like millions of parents, Michelle will be juggling work and helping her son with home learning.
Coming to my studio means that my son has a little bit of a break from the flat. Having him play football in the house, being away from his friends, managing technology, it's a challenge.
In Altrincham Market, all the traders are packing up again.
All the stalls are now empty. It's like going back to where it was in March of last year.
And for health workers like Naseem, it's going to be more long shifts in hospital.
A national lockdown was unfortunately necessary. My advice to all of you out there, please take it seriously. You could die from it.
No wonder the Prime Minister warned us that the next few weeks will be the hardest yet. But there was some positive news.
We've now vaccinated over 1.1 million people in England and over 1.3 million across the UK. And that includes more than 650,000 people over 80, which is 23% of all the over 80s in England.
Many think that you waited too long to bring in extra restrictions. How can they have confidence in your decision-making?
It's been clear that the Tier 4 measures were something that we wanted to evaluate. And over the course of the days leading up to Sunday, clearly, like everybody else in the country, we were hoping that we would start to see some impact.
The Chief Medical Officer said the country now faced a really serious emergency.
If people don't take the stay-at-home seriously, the risk at this point in time, in the middle of winter with this new variant, is extraordinarily high. What is going to happen over time is the risk level is gradually going to decrease, and we'll then get to a point where people say this level of risk is one that society is prepared to tolerate, and lift, right down to almost no restrictions at all. We might have to bring a few in the next winter, for example.
Mr Johnson's promised to give regular updates on the progress of the vaccination programme. The aim is inoculating around 13 million people by mid-February. The Labour leader said the nation must pull together.
We now need the government to deliver for the British people. And that means using this lockdown to establish a massive, immediate and round-the-clock vaccination programme to deliver millions of doses a week by the end of this month.
Across the UK, schools are closed for most pupils and many exams cancelled. There's still uncertainty over when that will change. The First Minister of Scotland said the new strain of coronavirus had driven everything off course.
Is transmitting so much more quickly. This whole thing has always been a bit of a race with the virus. We've now got the vaccines that we hope can beat it. So we have to up our game again to try to get ahead of it. The vaccines will help us do that, but while that's happening, we need to work harder to slow it down.
The question we all want an answer to is when will these restrictions end? Boris Johnson has been guilty of over-promising in the past. Today he made it clear it all depends on how smoothly the vaccination programme is rolled out. The pressure is on. Ministers are desperate to see improvements soon, but this is going to be a gradual process. Vicky Young, BBC News, Westminster.
Well, as we heard there, the Prime Minister said that 1.3 million people across the UK have already been vaccinated, and the aim is to administer the vaccine to around 13 million people over the next 6 weeks. An unrealistic target, according to some experts. By the end of the week, there will be almost 1,000 vaccination sites up and running, and the Chief Medical Officer, Chris Whitty, says that the target is realistic in his view, but by no means easy. Our health editor, Hugh Pym, has been considering the scale of this vaccination challenge.
Vaccination is now well underway across the UK, including at this centre in Lincolnshire today. But is the process moving fast enough to meet ambitious targets? Here, they seem optimistic.
I feel extremely honoured. I'm very grateful for everyone who's worked really hard to have this vaccine available to all of us.
We feel like it's the light at the end of the tunnel, and in that vial's just a little bit of sunshine shining through. So yeah, real game changer.
The Prime Minister said 13 million people from priority groups would be offered the first dose by mid-February. Top of the list are care home residents and workers, then all aged 80 or over and frontline health and social care staff. The 75 to 79-year-old group comes next, followed by 70 to 74-year-olds and all who are clinically extremely vulnerable.
My view is that the vaccine timetable is realistic, but not easy. And the NHS is going to have to use multiple channels to get this out, but they are very determined to do this.
The vaccine made by Pfizer has been available in the UK since early December, but it needs to be stored at very low temperatures, around minus 70 degrees. The Oxford AstraZeneca jab was rolled out this week. It can be kept in normal fridges, so is easier to distribute. There are vaccine challenges. There's a process known as fill and finish, where it's put into glass vials and packaged. There is a global shortage of these vials and so delays. So far, 4 million AstraZeneca doses have been through the process. Pfizer says it's delivered several million to the UK. Each batch then has to be safety checked by the Medicines and Healthcare Products Regulatory Agency. So far, 500,000 of the AZ doses have been cleared for use. Distribution isn't easy. The NHS will soon have 1,000 vaccination centres, from GP surgeries to football stadiums. GPs say they need a bigger workforce, but there have been problems recruiting people to do the jabs.
We've got tens of thousands of recently retired GPs and practice nurses and community nurses who really want to come back and help. They go online to try to register and they find that they've got to fill out 20 plus forms. They've got to find their exam certificates, often from decades before. But at the moment, I think there's a lot of people being put off by the bureaucracy.
Sorry, I've got really cold hands.
More than 1.3 million people have so far been vaccinated in the UK. Nearly a quarter of the over 80s in England have had their jabs. But no one's in any doubt about the importance of getting millions more immunised quickly as a way out of lockdown restrictions.
Good, thank you so much.
Hugh Pym, BBC News.
Well, more than 3,000 people have been admitted to hospitals in England every day in the first few days of this year. The number of people in hospital with COVID-19 is 40% higher than in the first peak last April, and it is still rising rapidly. The pressure is intense, not least because of the number of staff off work or self-isolating. And some doctors have compared working in the NHS right now to being in a war zone. Our health correspondent Dominic Hughes has the latest.
Becky James is living with a rare form of bowel cancer. She was expecting to have surgery in the coming weeks that could cure her, but COVID pressures in London mean the hospital has had to cancel her operation. Becky understands the reasons, but it's still hard.
I feel quite helpless. I can't plan anything. That's usual with cancer. I think it leaves me in limbo, as with hundreds of other people.
I think a lot of people listening to this would be quite surprised at how magnanimous you're sounding.
I think part of it is to keep calm, because the NHS are keeping calm. So my role is to keep calm.
Across the UK, the health service is struggling. At the Grange University Hospital in Cwmbran in South Wales, staff on the intensive care unit are witnessing the very worst of the virus.
It does feel like we're fighting a losing battle with a number of patients, and constantly phoning families to tell them that they need to come in because their loved ones are really reaching the end of the line. We haven't formally crunched all the data yet, but certainly anecdotally and from what I'm observing, I would say that our death rate at the moment is probably twice what it was in the first wave.
These deaths are directly related to how many people are catching the virus. In the last surge, cases started to pick up towards the end of September before peaking in November when the second lockdown had an impact. Since the start of December, infections have been on the rise again. Daily hospital admissions closely track the number of positive cases. While we have figures for England, the latest data for the whole of the UK only goes to just before Christmas. But we know that since then, cases have rocketed and admissions to hospital will follow suit. With nearly 61,000 new cases of the virus today, hospital staff are braced for some extremely difficult weeks ahead. Staff sickness isn't helping. Doctors and nurses, hospital porters and cleaners, like all of us, vulnerable to the virus. At Lincoln County Hospital, managers declared a critical incident for some hours after a sharp rise in COVID patients requiring admission. Another sign, if it was needed, that right across the UK, the virus is now fast running out of control. Dominic Hughes, BBC News.
So I've mentioned some of the official government figures a short while ago, but let's go through them all now as we do every night. And they show that there were 60,916 new coronavirus infections recorded in the latest 24-hour period. That's the first time since the pandemic started that the daily total has risen above 60,000. But testing is more widely available now compared to that first peak in the spring of last year. Now, the average number of new cases reported per day in the past week is now 55,945. 830 deaths were reported of people who died within 28 days of a positive COVID-19 test. And that means, on average, in the past week, 677 deaths were announced every day. And it takes the total number of deaths so far across the UK to 76,305. And once again, with me is Hugh Pym, our health editor. And what are you drawing from these figures today, Hugh? What would you guide viewers towards?
Well, Hugh, as well as those official figures, some pretty bleak numbers were set out at the Downing Street briefing. First of all, the UK case rate per 100,000 people up 70% in 2 weeks. And the Office for National Statistics, which does a community infection survey, suggests that 1 in 50 in England currently have the virus. That's more than 1 million people and definitely on the increase. Now, Chris Whitty, the Chief Medical Officer for England, did say that inevitably, because of more people in hospital, as we've heard, there'll be more deaths to report in the weeks ahead. There was one tiny sort of chink of light here, that he talked about the new variant in the southeast and London of the virus, cases associated with that. He said maybe it tailed off a little bit. The graph had flattened slightly, but not to read too much into it. But certainly the data is going to be key in the weeks ahead as officials and all of us assess what effect these lockdown restrictions have had.
Hugh, many thanks again. Hugh Pym there, our health editor. Well, in all parts of the UK, schools are closed to all pupils except for vulnerable children and those whose parents are key workers. Parents and carers are having to supervise homeschooling, with many lacking access to precisely the right technology and, in many cases, struggling with the cost. Our education editor, Bronwyn Jeffries, has been talking to teachers, parents and pupils at a school in Stoke-on-Trent.
Empty classrooms again. Most children back at home.
Yeah, so Thursday we've got the Zoom session.
But teachers in school planning online lessons, learning packs for pupils.
Like that. I was quite shocked before I thought, if you know what I mean.
Angela can't believe it's happening again. She works an hour a day as a dinner lady. Now she'll have daughter Lily learning at home.
She'll sit there for 5 minutes. 5 minutes, and that's good if you can get her focused for 5 minutes. And then as the minutes tick by, she's gone. Watching a video, I've got to sit with her because she's looking around, aren't you? Spinning around, standing on her head.
Schools have spent the day working out how to help families. It's not just about moving lessons online. Some children are still learning on their parents' mobiles, and a day of pay-as-you-go data on lessons could cost almost £100, leading to calls for data for education to be made cheaper or free.
Some children we found in the last lockdown didn't access the Zoom.
Catching up with his head teachers across Stoke, even with schools contacting families, some teens lose confidence, log out of lessons, disconnect from learning.
What really worries me is where those students aren't engaged and don't connect and they're not there for learning, even with the intervention, what they're doing every day. Possibly they're not in the house, possibly they're on the streets, but the only thing that stops them walking is school. And without school being there, they walk in a different direction completely.
It's like at the moment we're shopping.
But many parents like Vicky are determined to do their best. With 4 daughters, that's tough. In lockdown, she'll have to help the youngest most, keeping going, worrying about what they're missing.
They should be with a teacher who is able to have their attention to teach them properly. As a mum, you can't do that properly because you're not qualified as one. Well, obviously, you do your best, you do what you can. But I think that's all it is with me, how it's going to affect their grades and then mentally.
More than 500,000 devices have reached pupils. The government is aiming to double that, with more on the way to help those not in class but at home. Bronwyn Jeffries, BBC News.
Let's stay with schools because the BBC has announced its biggest ever selection of educational programmes for children who are staying at home during lockdown. From next Monday, there'll be at least 5 hours of programming on CBBC and BBC Two for both primary and secondary school children. And as schools are indeed closed to most pupils, ministers confirmed that this year's GCSEs and A-levels in England are being cancelled. Scotland and Wales have already announced the cancellation of major schools' exams. Some vocational exams in England, including BTECs, are still going ahead, though there is growing pressure to cancel them as well. Our education correspondent Elaine Dunkley has been talking to some of those who are due to sit exams during the summer.
A daunting walk into the exam room, and for millions of students, there has been confusion over whether they'll take place.
It's just a bit nerve-wracking because I've not sat here since my mocks, so it just brings back all the memories of exams.
Millie's Level 2 BTEC exam in Sports Studies is still due to go ahead next week, but her GCSE exams have been cancelled.
Me, for one, I'm really stressed about exams because we've missed so much, and it's just really hard to motivate myself to get up in the morning because we've not been in a straight routine for ages, and it's been remote learning, and our disruption to learning has been getting worse, seeing as more people are getting COVID, and it's just been really hard.
We've covered not even half of the A-level spec.
Max Bamford is doing A-levels. He's been revising for mocks which were due to take place in 2 weeks, but have now been cancelled.
So I think the issue is there's people out there who've not done as well in assessments within school and colleges they probably would have liked, who were relying on exams and mocks later on in the year to be able to get the grades that they needed. But then there's also students that have done really well in those that want teacher assessed grades. So whether you do some form of assessment or you do teacher assessed grades, there's always going to be sort of half of the students that aren't going to be happy with it.
I found it really hard. I only had a couple of weeks of online lessons. And
Astrid Finley understands the pressures and anxieties. She did her A-levels last year when a controversial mathematical model was used to determine grades, but was eventually scrapped and replaced with teacher assessments. She's using her experience to reassure students like Max who are worried about their futures.
With my year group, we went through the algorithm system that was put in place by the government, and obviously that was obviously not effective at all. So hopefully, having gone through that, there's a new year group of kids who will hopefully have a bit more of a revised, a bit more of an effective way to produce these grades.
I really hope we do.
Tomorrow, the government will outline how students will be assessed and graded.
And that's the big worry now.
For students like Max, the anxious wait for exam results day has been replaced with anxiety about what results will be based on. Elaine Dunkley, BBC News.
The Chancellor of the Exchequer, Rishi Sunak, is offering new grants to businesses in hospitality and retail and leisure of up to £9,000 to try to keep them afloat until springtime. And the move has been welcomed by industry groups, although they say the money is nowhere near enough to save many firms from closure. Our business correspondent Sarah Corker has more details.
We've got a 39-bed hotel closed, a bistro closed, ice cream parlour closed, a function room, a bar closed.
No customers, no money coming in, but bills still to pay. Entire parts of the economy are in shutdown again. Here in Clitheroe in Lancashire, this business has already cancelled hundreds of weddings and events. 400 staff are on furlough.
The stop-start process that we've been going through for 10 months now is very, very difficult because you can't make any kind of plans really. And a lot of the reactions are very short term, you have 24, 48 hours or whatever between the government saying one thing and then announcing something else. So that's been very, very challenging, I've got to say.
And for the in-house brewery here, a ban on takeaway alcohol sales is another blow. There is, though, more government support to help firms stay afloat.
For businesses in the most affected sectors who are asked to close, they will receive up to £9,000 in a one-off cash grant. It's important to remember that comes on top of the existing monthly grants of £3,000 that those businesses receive, and the extension of furlough all the way through to April.
Our high streets are virtually empty once again, and the economic resilience of retail and hospitality businesses is wafer thin. And they say what they need from government is a clear long-term plan.
If we can defer some of the loan repayments.
This Manchester bar and distillery supplies gin to other hospitality businesses. Sales are down nearly 80%.
There is extra financial support. How much will that help you?
While it's a nice news story that they're giving an extra £9,000, it doesn't go not nearly far enough. We need business rates relief again for another year.
We need VAT deferment. They introduced some measures in first lockdown, but they need to look at extending those, at least till businesses can reopen to get back on their feet and start trading again.
Essential retailers can continue trading, and unlike the first lockdown, that includes garden centres in England this time. But in Clitheroe today, there were few customers.
We're looking at staffing levels all the time. Currently we're on a minimum staff, we're on a very, very skeleton crew. We're highly delighted that we can stay open, but at the same time there's massive challenges ahead.
Vaccines offer hope and a way out of this crisis, but the question is how many businesses can survive the winter months. Sarah Corker, BBC News in Clitheroe.
So England and Scotland joined Wales and Northern Ireland last night by introducing strict lockdown measures faced with these rocketing numbers of new COVID infections. In a moment, we'll be hearing the latest from Emma Vardy in Belfast and Howell Griffith in Cardiff. But first, here's our Scotland correspondent, James Cook.
Scotland's lockdown is actually quite similar to England's, but there are a few key differences. For example, there's no limit here on individual or household outdoor exercise, and under 12s are allowed to play together outdoors. Schools are shut here for most pupils, but so too are nurseries, although both will be open for the children of key workers and for vulnerable pupils. Places of worship are closed in Scotland, a decision that's been described by the country's Catholic bishops as arbitrary and unfair. The First Minister of Scotland, Nicola Sturgeon, says she accepts it's distressing, but she insists it is necessary. And Ms Sturgeon has been giving an update on the number of people in hospital with COVID-19. She says that's risen sharply over the past week, and she warns that without this lockdown, the NHS could be overwhelmed within weeks.
Here in Wales, people have been required to stay at home for the last 2 weeks, and the lockdown has had an impact, with coronavirus case numbers falling in most areas, but they remain high at an average of around 400 cases per 100,000. Yesterday, the Welsh Government decided it was too soon to send pupils back into the classroom, closing schools until at least January the 18th. But the question is whether that will be too soon. Some unions want face-to-face learning suspended until February. The Welsh Education Minister says keeping schools closed can have grave consequences for pupils. There will be a review, but it all leaves teachers, pupils and parents wondering what to prepare for later this month.
Northern Ireland is in a 6-week lockdown, but now ministers are going even further. So the stay-at-home rule is becoming legally enforceable by law. That means not leaving the house except for essential reasons like food shopping and exercise. And because of the dramatic spike in cases since Christmas, now schools will remain closed to most pupils up to the mid-February half-term, with online learning for pupils in the meantime. And there's been particular controversy here over transfer tests. Those are the exams used to select pupils for Northern Ireland's grammar schools. They had been cancelled, but now some are going ahead after all. But one big priority for ministers here is to try and bring people back to following the rules much more strictly.
Emma Vardy there, ending that sequence for us in Scotland, Wales and Northern Ireland. Now, the tougher restrictions on people's lives are there to slow down the spread of the virus and to bring down what's known as the R number, that is the rate at which the infection spreads. Our science editor David Schuckman looks at how the rate of transmission can be slowed down.
Lockdowns have worked before, but will they work again now? The virus can only spread through human interaction, and when that's reduced, with scenes like this, the number of infections falls as well. But now there's the new variant, and its impact is still being investigated.
We have no guarantee that the lockdown now announced will work. I think that's the challenge. We have seen in the last 2 weeks that cases in that critical age range, 11 to 18-year-olds, of the variant this is, in places like London, the southeast and east of England, have started to come down. The case numbers of the new variant in the adult population continue to rise.
A key measure of what the new lockdown has got to achieve is the R number. That's basically how easily the virus is spreading. Last March, the number was 3, meaning that if 10 people were infected, they'd pass the virus to 30 others, who in turn would pass it to 90 more. So the disease was really escalating. Now, the first lockdown last spring brought that right down to 0.6, meaning that if 10 were infected, they'd only infect 6 others. And whenever the R number is below 1, it means the epidemic is shrinking. Right now, we're back up to an estimated 1.3, and that's despite all the restrictions under the tier system, a measure of partly how infectious the new variant is. Closing schools should help to reduce the spread of the virus, maybe by enough to stop the epidemic from growing. And some very early signs suggest that that may be happening already.
We're in a very difficult situation here, but I think, yes, my sort of initial assessment of the last few days is that perhaps it does look like it's slowing. The rate of increase is slowing, which is very good news.
But what if the new measures aren't enough? One hope is that messaging about the risks will encourage people to follow the guidance more carefully. Another is that with improvements in testing in recent months, we'll be better able to track the disease than we could early last year. And if the vaccination programme rolls out as planned, that will make all the difference. But we're not there yet. David Shuckman, BBC News.
Now, for 9 months, the aviation industry, among others, has been calling on the UK government to introduce testing for travellers coming into the UK. Boris Johnson now says the government will bring in measures, widely expected to be some kind of COVID test for some travellers, and the move would bring the UK then into line with many other countries. But let's get some more details, if they're available, from the government, from our correspondent, Caroline Davis, our transport correspondent. What do we know exactly, Caroline?
Well, at this stage, relatively little, Hugh. We do know that if this test is brought in, it's likely to apply regardless of how you travel to the UK. So you could come by plane, train, ferry. You're still likely to have to show a negative COVID test. What we don't know is what type of test they might be looking to use. We also don't know whether this will apply for UK nationals as well as foreign nationals travelling to the UK. Now, speaking to those in the aviation industry today, there is frustration. Many of them, as you say, have been calling for testing for some time, since relatively early on in the pandemic. And many other countries around the world already require a negative COVID test in order for you to be able to visit. There have been steps taken by the UK government to try to limit strains of the virus originating in other countries having an impact in the UK. So, for instance, flights from South Africa are currently banned. The government would also point to schemes like the travel corridor scheme and quarantine test to release schemes that they say have managed imported infections. But it's clear that at this stage they're trying to take this a step further. One other element of travel as well, Hugh, fewer passengers means it is likely that we will see train services reduced at the start of this year, which is just another impact of lockdown.
Caroline, many thanks once again. Caroline Davis there, our transport correspondent. Now, the pandemic has so far claimed the lives of more than 76,000 people in the UK. The scale of the losses means that a much wider community of family and friends has been dealing with grief and shock, a process made even harder in periods of lockdown when communication and contact is, of course, much more difficult. John Kay, my colleague, has been talking to people who've been affected in the process of this pandemic.
I've been with Rob for 25 years. We met through a Lonely Hearts Club.
Colin lost his partner Rob just before Christmas. COVID caused blood clots on his lungs. He was 56.
Rob was a very fun-loving person.
And we could be together, baby.
Very outgoing, friends with absolutely everybody.
It's Rob here again. Welcome to Melbourne.
This time last year, the couple were on the holiday of a lifetime. Now, Colin faces the new year alone.
And the outpouring that we've had since his death, messages I've had on Facebook, have been absolutely brilliant, and they've helped me through it all.
When the pandemic began, Rob decided to leave his desk job in the NHS to work as a nurse in A&E, helping COVID patients. His funeral cortege went past Bristol's Southmead Hospital.
He wanted to be on the front line. He felt that he was more used doing things like that than being in research. I think I'm going to find things now very quiet. Everything just seems empty.
I've tested positive for COVID. Breathing is okay.
In the days before Christmas, Rachel's auntie Jan said she was coping fine, but her situation rapidly deteriorated.
I then sadly messaged her on Christmas Day, not realising that when I messaged her it never went through, she had actually passed.
Jan Docker was 55, a special needs teacher in London with no underlying health problems. It was the suddenness of her death that shocked her niece the most.
I think people's perception of COVID is that you get ill, there's warning, you'll end up in ICU, there's time to kind of, hopefully recover or say goodbye to loved ones. But in our case, it was sadly not to be.
How has what happened to her affected the way you view this virus?
I've seen how bad it can be for people, but it's not until you lose a loved one do you realise actually how dangerous this virus is.
What would your message to people be from where you stand?
All I can say to people is, please, please, obey the rules. I don't want anybody else to go through what I've gone through, and I just hope that we come out of it soon.
John Kay, BBC News, Bristol.
Just a few of the many families and friends dealing with grief and loss during this pandemic. That was John Kay reporting there. And that's it. Now on BBC One, it's time for the news where you are. Have a good night.